morning. My name is Richmond Boateng. I am going to perform nursing head to toe assessment for my final in advanced literacy course. I will cover the hair and all the way to the toes. I will inspect the eyes, the ears, the nose, and the throat. I'll begin by showing you my equipment. I have my otoscope here. I have my thermometer. I have my turning fork here, and oximeter is here. I have my hammer. I have my stethoscope. I will go to the sink to wash my hands. It is understood that you have to wash your hands for at least 15 seconds to get rid of all the germs. Hello, good morning. My name is Richmond Boateng. I am going to be your nurse for this afternoon. May I know your name, please?
Grace.
Grace, how are you? Good. Grace, have a seat. Can you tell me your date of birth?
0824.
All right.
6.
Do you know which month we are in?
April 10th,
Do you,
2001.
do you know the president of United States?
Biden.
Okay. So Grace is alert and oriented times 3. Upon inspection, I can tell that she is very healthy. She eats well. Her skin turgor is very good, soft, smooth. No lesions or no laceration. Grace, may you please step down so that I can get your weight? All right, good. So Grace is 87 pounds. Grace, have a seat and then have a seat for me, please, Grace. I will check your blood pressure. Your blood pressure is very good. It's 120/62. I'll proceed to check your temperature and then your oxygen saturation. Your temp is 97.3. Your oxygen saturation is 95%. I will check your pulse. The pulse is 60 and her respiration is 20. Grace, I'll begin by checking your hair and your head. Will you mind if I take,
No, I don't mind.
put on my gloves? I'm checking my patient's hair and the head for deformities, infestation, and lumps. I can tell that the hair is very smooth. She's very healthy. I don't feel any lumps. Take off my gloves. And then I'll wash my hands again. Come back. And then I'll check the facial muscles, which is cranial nerves 7. Grace, can you please smile for me? Can you frown your face? Can you move your head from side to side? Excellent, excellent. Can you put one finger on the one nasal and then breathe through? Okay, do the other one. Excellent, excellent. I can tell that the nose is at the midline, the face is symmetrical, the head is symmetrical as well. I will then move on to inspect the eyes. I will look at the conjunctiva. It's pink and moist. The pupils are white. No redness. Notice the iris is okay, it's good. I'll then proceed and get my pen light and check for eye accommodation. Can you just look at me? Straighten up your head a little bit for me, please. Good. For the eyes. Okay, I can tell that the pupil has constricted. And then it has dilated when I move from it. Just look at me straight. Follow that, follow the pen. Good. Excellent. Checking for accommodation. Good. Excellent. Excellent. The next thing that I'm going to do, I'm going to check for the eye acuity. Grace, I'm going to hold this, and then I want you to read the last line.
LT FPH.
Good. So her eyesight is 20/20. Which means that Grace eyesight is equal round, reactive to light and accommodation. I will proceed to inspect the ears. Before that, I'll inspect the ears first. I'll palpate it behind the ears. It's clean. It's clean. Grab my otoscope. I'll inspect the left ear first. Here, hold the earlobe up and then behind. The eardrum is pale gray. The tympanic membrane is pale gray. There are no drainage. There are no wax. And the eardrum is not ruptured. I will check the other ear as well. The other ear is similar. The tympanic membrane is pale gray, no ruptured eardrum, no drainage. Do you feel any tenderness?
No.
And denies ear pain. Grace, the next thing I'm gonna do, I'm gonna check your hearing. We call it bone conduction, all right? So tell me when you stop hearing it. Can you hear it? Tell me when you stop hearing that.
It's okay.
It's okay, you can't hear it anymore. Try the other one, tell me.
It's okay.
And the last one, tell me when you stop hearing it.
It's okay.
Okay. It means that her bone conduction is good. He can hear very well. The next thing I'm gonna do, I'm gonna palpate the temporal arteries. I'll move on to the cranial nerve 8, which is the nose. I'll inspect the nose. The nose is well centered in the midline. I'll ask the patient to close one of the nose. I think we did that already, so I'll move on. I will look inside the nose to be sure that she doesn't have any deviated spectrum. Lift your head up a little bit for me. I don't see any deviated spectrum in your nose. Excellent. Then I'll palpate your sinuses. Any tenderness?
No.
Any pain? Any tenderness? Any pain?
No.
Excellent. Excellent. Good. The next one that I'm gonna do the olfactory, which is the cranial nerves number 1. Close your eyes for me, Grace. Tell me what you smell. Ginger, which is good. I have ginger here, which means that her smell is really good as well. I'll then put on my gloves and then I'll check the mouth. Before I check the mouth, I'll inspect the lips to make sure that the lips are moist and pink. Her lips is moist. It's not dry. No, it's not chapped. I have my tongue depressor here. Can you please open your mouth for me? All right. Can you move your tongue left and right? Excellent. Underneath your tongue. Okay. It's moist and pink. The gums are healthy. I don't see any broken teeth. Teeth are clean. I'm gonna check the uvula. Say ah for me. I can tell that the uvula is moving up and down. It's not inflamed. And then I'm gonna check her gag reflex. Sorry, I'm gonna just push this a little bit, okay? All right, excellent gag reflex. Good. I'll take my gloves off and then wash my hands one more time. Wash my hands. I'm back. I'm gonna check for the neck. Looking at the trachea to make sure that it's at the midline. I'll palpate it to make sure that there are no lumps, and then try to swallow for me. I can tell about the swallowing reflex is there. Can you move your head from side to side for me? Up and down. That is the cranial nerves. Number 11, the accessory muscles. They are perfect. I'm going to hold your shoulder here and I want you to shrug for me. Good. You have a lot of upper body strength. Okay, you are good. I'm going to check about the jugular vein distension. Can you tilt your head the other way? This side, all the way. I don't see any distension of the jugular. The other way. Excellent. Excellent. You are a very healthy lady. The next thing I'm going to do, I'm going to palpate the carotid artery. And it's supposed to be done one at a time. All right, let me see here. Excellent. And then I'm going to use the bell of my stethoscope to listen if I can hear any brewing. There are no brewing. I'm going to palpate the radial pulses. Excellent. And then I'll palpate your brachial pulses. I will check the range of motion of the fingers. Then I'll check the range of motion of the arm. I will check your capillary refill on the fingers. It's good. It's less than 3 seconds. Less than 3 seconds. And then I'll check for your arm strength. Lift your arms up. Okay. Okay, push. Very, very strong. Excellent, excellent. Can you please stand up for me, and then I'm gonna check for a drift. Move here. Up. Move up. Good. Lift your hands up for me, and no, straighten up, and then close your eyes. Close your eyes. Good. I don't see any drift. Now open your eyes for me. All right. Walk on your toes for me. Walk on your toes. Good. Good. Walk on your heels. Walk on your heels, not backwards, forward. Walk on your heels. I don't want you to fall. Good. Excellent. Excellent. It's okay. Turn around and come and have a seat for me. Okay, her mobility is very good. Her gait is very stable. No deformities. Excellent. Excellent. Now, the next thing that I'm going to do is I'm going to ask you to lay down for me so that I can auscultate your heart sounds. All right. I'll first inspect her breathing. You can tell that her chest is rising and falling. She is not using any accessory muscles to breathe. It's good. So I'm going to check the 5 points of the heart sounds. I will start by checking the aorta. Then I will check the pulmonic. I'll check the L's point. I'll check the tricuspid. And then I'll check the mitral valve. I will repeat the same thing again to check for the heart murmur, but this time with the bell of the stethoscope. Whilst I did not hear any heart murmurs. Whilst I have my patient laying down, I will check the lung sounds as well. I will listen to the lung sounds. I'll begin by listening to the trachea. Take a deep breath. And then out. Check the right upper lung fills. Take a deep breath. Left upper lung fills. Deep breath. I'll check the mid left. Deep breath and out. Mid right lung fills. Right lower lung fills. Take a deep breath for me. And then the last left lower lung fills. Excellent. I'll ask my patient to sit up. I'll help you to sit up. So that I can do the same thing on the posterior back. This way, the back. I'll begin by inspecting the back to make sure that there are no lesions, there are no rashes. And then I will listen to the lung sounds. Take a deep breath for me. Out. Excellent. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. All her lung sounds are clear. No adventitious sounds heard. The next thing I'm gonna do, I'm gonna inspect the abdomen. So the abdomen have 4 different quadrants. We have the left upper quadrant, left lower quadrant, right upper quadrant, and then right lower quadrant. You can tell that her abdomen is protruding. I'm going to precurse it first. I'm going to auscultate it first, and then I will precurse, and then I will palpate. So I will start with the left upper. So before I move on to precurse the abdomen, I'm going to ask you some few questions. Do you have any abdominal issues? Any constipation, any nausea or vomiting? When is the last time you moved your bowels? This morning? All right. So I'm going to precurse the abdomen. So resonant sounds. Resonant sounds. So I'm going to palpate the abdomen. I'm going to do the light palpation first, and then I'm going to do the deep palpation. All right. I'll start with the left upper. It's a light palpation. Any pain or any tenderness? No. Any pain or any tenderness? No. Any pain or any tenderness? No. Okay. Then I'm going to do the deep palpation. You're going to go a little bit deep. Any pain? Any pain or any tenderness? Any pain or any tenderness? Any pain? The next, I'm going to move to the GU. I'm going to move on to the GU. I'm going to inspect the bladder and then palpate the bladder, the kidneys, and ask a few questions here. Do you have any difficulty in urination?
No.
Excellent. Have you ever urinated blood?
No.
All right. All right. Any pain? Any back pain?
No.
All right. You want to get up for me? I'm going to check the ankle. I'm going to check the reflexes. I'll begin by checking your ankle reflex. Relax, relax. Okay. Okay. Move up a little bit from here. So that the edge of it from here. Okay. Now check the knee reflex. This one moved. This one didn't. Try it one more time. When I check the hand reflexes. Good. Then I'm gonna inspect the lower extremities, the leg and the foot for any edema. I will pinch it to see if there is any edema. There are no edema. You can tell that the legs are smooth, the skin is very healthy. I will look at the foot to make sure that there are no deep tissue injuries. The heels are clean. The heels are clean. Then I'll check for the pedal pulses. Oh, I can feel this one. Then I'll check for the tibial pulse. Then I'll check for the popliteal pulse behind the knee. Okay. I'll go and wash my hands, and then I will come and palpate your lymph nodes. So when was your last menstrual period?
April 1st.
Okay. So I'm going to palpate the lymph nodes. Behind the ear. Any tenderness?
No.
All right. Excellent. I am almost done. Here I'm gonna have to sit a little bit and then ask you a few questions here. So, Grace, do you have any medical problems? You take any medication?
Yes.
What kind of medication do you take?
Genevia.
Genevia? How often do you take Genevia?
25 milligrams once a day.
What do you take Genevia for?
Diabetes.
Diabetes, okay. Do you check your blood sugar?
Yes, I do.
Okay. How often do you check your blood sugar?
Twice a day.
Okay. How is your appetite?
Good.
Good, okay. Can you tell me what you ate this morning for breakfast?
Banku and okra soup.
Banku and okra soup, okay. All right. What do you plan to eat this afternoon?
Rice.
Okay. So a little bit education here. That is good to eat a balanced diet. Meals that have vegetables and fruit in it. One other thing also is that to exercise at least 30 minutes a day. Do you have any family history of high blood pressure?
No.
Any family history of stroke or heart disease?
No.
Okay. All right. Do you have any questions for me?
No.
No questions for me. Thank you so much, Grace, for allowing me to use you for this physical assessment. God bless you. All right.